Hello, my name is Ahmad bin Azmi from PDR of Year 2. My matric number is A195772 and this is my pre-departure video before I go to the clinical in the oncology and radiotherapy department of HCTM. First, I would like to talk about my student preparation. So before the departure, I first do some research into the oncology department, and then afterwards I also do some more research into the hospital itself and the machinery in the department, because I want to learn about the kind of radiotherapy equipment that I'm going to use, as well as the CT simulator. And then I research the role of radiotherapy trainees, that as in the type of stuff that we as a radiotherapy trainee must do while in the clinical. Secondly, I do some logistic preparations. For example, I make sure the essential items like lab coats, scrubs, and notebooks are prepared. And second, I arrive early at the faculty to catch the bus to the hospital. This is very important because the time of work for the clinical starts as early as 7 a.m. So, my plan when I arrive at the hospital is that I first will go to the oncology department in HCTM, and then I will report to the person in charge of my clinical, and then I will start my clinical. Now let's get into the department overview. As we can see, this is the organization chart of the oncology and radiotherapy department in the Hospital Chancellor Tuanku Mukhris. As we can see, the head of the department is Professor Datuk Dr. Fuad Ismail, and under him there are multiple people working in various different fields. But the main ones that we are going to deal with are Dr. Hilawati Yusof, Dr. Marfu'ah Nik Ezamuddin, Professor Datuk Dr. Fuad Ismail himself, which is the department head, Dr. Khairiyah Hidayat. So now let's get into the modalities and instruments that I'm going to use while in the clinical. As a second year clinical, we will mostly be doing simple tasks. So I must familiarize myself with items like the thermometer, the blood pressure machine, and the ECG machine. So I have quite a few expectations about what I will have to do while in the clinical. First, there is the role of the radiotherapy trainee. All of these are stuff that I've researched before I go to the clinical. Firstly, the role of radiotherapy training is that they must learn about how the radiotherapy department works and be proactive in asking questions. I must also assist in doing activities like taking the patient's vital signs, guiding the patient to the treatment area, and preparing the patient. At later stages, I should participate more heavily in the patient treatment cycle by doing CT simulation, checking the preparation of the treatment plan, and help preparing the linac before treatment. And ultimately, I must ensure that patient comfort and I must ensure that the patient is comfortable before the treatment or during the simulation, and also must adhere to the safety protocol in the department. Now for the practical information. As a radiotherapy trainee, I must be well informed about daily routines, tasks, and procedures that took place within the hospital. To do this, I must be proactive in asking questions to the person in charge, and also participate in all the activities. Secondly, I must familiarize myself with the equipment and instruments in the department by doing a lot of activities with them, and also by asking the other people there about how they are used. And finally, I must gain knowledge about the various radiation therapy techniques, mainly by observing them and taking in notes. So for the ethical considerations, patient confidentiality must be respected at all times. I must conduct myself with professionalism, compassion, and integrity at all times. I must develop effective communication skills for interacting with patients and their families. And most importantly, the Hippocratic Oath must be followed, and I must do everything I can to reduce harm to the patient. This is especially vital since we are dealing with radiation here. So that is all. Thank you.